A lot of people are surprised, sometimes even shocked, that when they start Medicare, they find out that it's not free. They've paid taxes into Medicare for 30 years, 40 years, sometimes even longer, and they expect that when Medicare starts, they've already made all their payments into Medicare. But Medicare absolutely has some costs, and it's important that you understand what they are so that you can plan accordingly as you're going into retirement. You need to know what your out-of-pocket expenses are going to be. So there's different costs in different pieces of Medicare. Right now I'm going to talk about Medicare Part A. So when you have original Medicare, you have Part A, you have Part B. So I'm going to talk right now about Medicare Part A. I just wanted to jump in for a quick second and invite you to join my private Facebook group, Talking Medicare, where you can get answers to just about any questions on Medicare and interactions with others that are also in Medicare. There are no agents, no sales whatsoever. It's absolutely free. Just visit talkingmedicaregroup.com. It'll take you right there. You can sign up for free. Easy to do. Enjoy the video. Okay, so Part A, and again, why they break it down into these pieces, I don't know, but they separate them. So we got to take them kind of piece by piece. Medicare Part A covers hospital stuff. So it's basically going to cover your room and board in the hospital. It'll cover things like inpatient hospital care, also skilled nursing, nursing home care, hospice care, home health care, and will also include a semi-private room, meals, medications, nursing, and lab services. So those are the things that fall under Medicare Part A. Doctors and things like that fall under Medicare Part B. We'll get into that in a different video right after this one, but Medicare Part A covers the inpatient side of the hospital. So first thing to understand is a lot of these costs really aren't going to play in because you're not likely going to have just Medicare Part A and Medicare Part B. You will likely have a Medicare supplement plan that covers a lot of the stuff we're going to talk about, or a Medicare Advantage plan that kind of changes the way that it functions. It makes it a little different in how the costs come out of pocket. So right now we're going to just talk about Medicare Part A. So if you had original Medicare A and B alone, these would be the expenses that you would be looking at. So first we'll talk about premium. For most people, there is no premium for Medicare Part A. So that is the good news. So if you have worked your 40 quarters, 10 years, you've paid into Medicare, you will not have a premium for Medicare Part A. Now, if you have worked for just a portion and you didn't get 40 quarters worth of payments into Medicare, then you would face a premium. If you work for 30 to 39 quarters, the premium would be $278 a month. So not small. If you have worked less than 30 quarters, the premium is $505 a month, so rather large. So if you can face it in two different ways, individually if you've paid into it, or also through a spouse. So it works kind of the same way that Social Security does it. But for most people, our premium is going to be zero for Part A. So that is the good news. Now, Part A does have a deductible. The deductible is what you would pay before the plan starts to pay. So Medicare Part A does have a deductible. And again, if you have a Medicare supplement plan, it's going to cover this deductible in full. So there really won't be any out-of-pocket costs whatsoever. But Part A has a deductible when you are admitted into the hospital, and it runs on a benefit period. So it's not an annual deductible, it's per benefit period. So you could have it multiple times during the year. So that is one reason certainly you would have a Medicare supplement plan, is to make sure you don't have that out-of-pocket cost. And the deductible for Part A right now is $1,632. So it's a big deductible. Last thing you want is when you get admitted in the hospital, have to come up with $1,600 right off the bat before anything is going to get paid for. So Medicare supplement almost always covers 100% of that Medicare Part A deductible. And keep in mind, it's per benefit period. That benefit period runs on a 60-day window. So if you go into the hospital, you would have the deductible. If you go back in for the same thing within that 60-day window, then you would not have another deductible. If you go back into the hospital after that 60-day window, then that deductible is going to reset. But the Medicare supplement would cover it each time, so there would not be an out-of-pocket expense to you. So that gives you an idea on the deductible. Now, Medicare Part A also has co-pays. So if you're in the hospital after the deductible, you could possibly have a co-payment on your room charges. So day 1 to 60, there is no co-payment. So it's covered 100% after that deductible. Day 61 to 80, there's a $408 per day co-payment for room and board. So a big co-payment per day. Again, a Medicare supplement plan would cover that. A Medicare Advantage plan would make it in a different fashion. So Medicare Advantage plans are a little more complicated to understand because they structure their out-of-pocket costs differently, and they all have different benefits. So it's hard to generalize exactly what a Medicare Advantage plan out-of-pocket cost would be. On day 91 to 150, God forbid if you're in the hospital for more than 90 days, that copayment is going to go up to $816 per day in the hospital. Now, once again, just about every Medicare supplement plan covers that. So you would not have that out-of-pocket expense if you are in the hospital with original Medicare A and B and a Medicare supplement plan. So that gives you a pretty good idea on the copayment for inpatient. So for skilled nursing care, runs a little bit differently. And skilled nursing care is only for rehabilitation. So you need to be kind of discharged into a skilled nursing facility for rehab. So if you broke your hip and you're having trouble walking, then that's where a skilled nursing facility, it's not for long-term care, it's simply for rehab. And in order to qualify for skilled nursing care, you have to be inpatient hospital for at least 3 days. So you couldn't get into a skilled nursing facility under Medicare if you were not inpatient hospital for at least 3 days. So the way a nursing facility works is day 1 to 20, there's no copayment. Day 21 to 100, there's a $204 a day copayment. But again, most Medicare supplement plans cover that. Medicare Advantage works a little differently, so it's a little more, again, convoluted on the Medicare Advantage plan. Day 101 going forward, there you'd be responsible for all the costs, and that is with a Medicare supplement as well. So skilled nursing facility under original Medicare is only covered to a maximum of 100 days. So that's a pretty long rehab, pretty rare in a rehabilitation scenario. In other words, you have to be showing improvement in order to be able to stay in the skilled nursing facility. It is not for long-term care. It is only for rehabilitation. Now, home health care is also covered under Medicare Part A, and there is a $0 copayment for approved home health care. So generally, they would rather you stay at home and use home health care than be in a skilled nursing facility, certainly much less expensive to utilize. So home health care is covered under Medicare Part A. Durable medical equipment has a $20 copay. So if you needed crutches or a wheelchair, then if it's medically necessary and approved, it has a 20% copay. So those give you a pretty good idea of the out-of-pocket costs for Medicare Part A. And again, if you have a Medicare supplement plan, most of those costs are covered, and generally at 100% after a smaller deductible. So it's important to understand that. You can certainly watch my videos on best Medicare supplement plans. I explain it all exactly how they work hand in hand, and that's absolutely what I recommend is original Medicare A and B with a Medicare supplement, either a Plan G or a Plan N. Sometimes a high deductible G makes a lot of sense if the premium is going to justify having a higher deductible. So we want to find the best value, so when we put all this together, at the end of the day, you have fantastic coverage with very little out-of-pocket expense. And the reason to stay with original Medicare is because you can go to any doctor, any hospital in the country without having to ask for permission. You also don't have pre-authorizations, so when you need something done, you don't have to get permission from an insurance company to have it done. And that's one of the biggest complaints from anybody is if you needed something and your insurance company says, well, no, we're going to make you try this instead. It's just not the way to go. If your doctor thinks it's something you need and you agree, then it's something you ought to be able to do. And that's what happens with original Medicare. Satisfaction is fantastic with A, B, and a supplement because you just don't have any hoops to jump through. So I hope you found this helpful. I have another video going over Medicare Part B. And if you haven't downloaded my book yet, I'll show you how to do that right now. Hope you have a fantastic day. Thank you for taking the time to watch my video. I hope you found it very helpful. A couple of other things that you'll also find very helpful. Number one, download a copy of my free book, Medicare Made Clear. I spent a lot of time and a lot of effort putting this together, and it has everything that you need for Medicare now and in the future, down the road. I have videos in the book. I have all the links that you need for things that you'll want to do within Medicare. You can access it right in the book. Very easy to do. Just visit medicareonvideo.com/free book, and you can download it for free. You can save it on your computer. You can save it on your iPad. It's a great resource to have, again, for now and in the future. Another thing that you'll find helpful is down the road, when you come into Medicare, sometimes it makes sense to do a price check on your Medicare supplement plan. So I made it very easy to do that as well. Just visit medicarepricecheck.com. Put in your basic information, and we'll email you a quote on your same plan that you have right now, a G or an N or an F, whatever it may be, and likely we'll be able to save $20 to $60 a month in premium, because a lot of times plans come out with better rates. So if we can get a better rate for the same plan that we currently have, just makes a lot of sense. And then obviously take advantage of all the information on my website at medicareonvideo.com. I have everything that you need right there for understanding IRMA, understanding employer work coverage, everything that you need, especially in the guides and forms section, you'll find right there. So we update everything every year, so everything should be up to date and current with the right deductibles and premiums and things like that. Hope you found all this helpful. Have a fantastic day. Wait, don't go anywhere. There's a couple more videos right here that you'll find very helpful with your Medicare journey. So take just a minute, watch the videos. You can also subscribe to my channel by clicking this button, and that way you'll have access to all my videos for everything that you need for Medicare. Hope you find it helpful. Have a fantastic day.